I opened up in an area that's surrounded by retirement communities, so a lot of our patients are in the Medicare age group. A lot of them have diabetes, a lot of them have peripheral arterial disease. We treat our diabetics with a team approach. We make sure that we examine them very carefully on the initial visit. We give them a lot of diabetic education and instruction. We optimize our use of the diabetic shoe program that Medicare provides for diabetics. We usually make sure that we check the circulation first, and for this we have an instrument that gives us the ankle brachial index. It's a Doppler machine, and it gives us a very good index of suspicion as to whether or not the patient has peripheral artery disease. If it turns out that the arterial circulation is severely impaired, we have close connections with vascular surgeons. We have one who has a very advanced technique now, a new one, where he can actually ream the cholesterol out of the artery without having to open the whole leg up. It can be done under a local anesthetic. We also have a lot of patients with a diabetic condition called neuropathy, where the nerves are involved. It can be very painful. It causes a lot of numbness and tingling in the feet. We have a test for that as well. We do the nerve conduction test. It tells us whether the patients have neuropathy, whether it's mild, moderate, severe. Sometimes it tells us whether it comes from the fifth lumbar vertebra or one of the sacral vertebrae. And if we get a positive test for these and we find the patient has poor circulation or has neuropathy, we also have a physical therapy modality, a very new one just on the market called microvasc therapy. This can actually generate new blood vessels and even new nerves. It's the only technique I know of that can actually improve neuropathy. We have our patients on this microvasc therapy, and we get some remarkable results from it. Patients tell me they can feel grass under their feet for the first time in years. We have a gentleman who went back to driving. He couldn't drive before because he couldn't feel the gas pedal under his feet. So this is a very successful thing. Some of our most severe patients actually have large open ulcers on their feet, diabetic ulcers that become infected. That leads to the amputations that diabetics face. People on microvasc therapy, we have actually closed a lot of these very, very difficult ulcers. And right now we're looking forward to some very new technology where we can actually draw the patient's blood, spin the blood down so we can get the growth factors out of the blood, apply those growth factors to the patient's wounds that won't heal, and this is allowing the wounds to close. Medicine has come a long way. Science is finally filtering down to the level of the clinic, and it's a very exciting time for me. I'm happy to be on the cutting edge of all this, and I'm learning about all these new techniques, cloning, genetic engineering. All these things are becoming available to the doctor now, and we're applying all of these to our limb salvage procedures, limb preservation procedures, and I'm happy to say that in many cases we've canceled the scheduled amputations for some of these patients.